Hi, welcome to today's webinar on the Millennium Cohort Study, particularly focusing on the new sweep of data, MCS 6. I hope you can all hear me. Hello, I'm Vanessa Moulton and I'm the Research Officer working on the Millennium Cohort Study. Just a little bit of housekeeping. There are no microphones or videos on this, but you'll be able to use the chat button, which is at the bottom right of the screen, where you can send us questions throughout the presentation, and we'll try and answer them at the end of each session. I'm going to start by giving a brief introduction to the MCS before we get into the exciting sessions looking at the new Sweep 6 data. So just to give you a brief overview of the cohorts held at the Centre for Longitudinal Studies, the Centre is responsible for 4 cohorts, of which the MCS is one. The first is the National Child Development Study, a cohort born in 1958, who are soon to celebrate their 60th birthdays. Participants in the British Cohort Study were born in 1970, so now middle-aged, and participants in Next Steps were born in 1989, 1990, and are in their mid-20s. In fact, we'll be launching the age 25 data in the next few months. And lastly, the focus of this workshop, the MCS, whose participants were born in 2000, 2001, and are now mid-teens. So briefly, the Millennium Cohort Study is a birth cohort study of over 19,000 children born in 398 areas of the UK. We have one cohort of children born in slightly different periods in different countries. For England and Wales, the children were born over a year between the 1st of September 2000 and the 31st of August 2001. However, in Scotland and Northern Ireland, the children were born over a slightly later and slightly longer period between the 24th of November 2000 and the 10th of January 2002. This was to compensate for lower than expected birth rates in these countries. The aim of the MCS was to create a rich and easily accessible scientific resource shaped by expert input. It's a multidisciplinary survey intended to fulfill multiple purposes, and it was designed to capture the influence of early family context on child development and outcomes throughout childhood, into adolescence, and into later life. A useful paper which gives an overview of the MCS is Joshua and Fitzsimmons, and it covers sweeps 1 to 6, and they go into more detail about the objectives, the structure and content of the study, and how it was shaped by its cohort forerunners and by the context of its funding. So, moving on to the main objectives of the MCS, which are to chart the initial conditions of the social, economic and health advantages and disadvantages facing new children in the 21st century and their consequences, to capture information for the future, so we want to collect information which will be useful in predicting outcomes in later life, to compare patterns of development with other cohorts, so how does the experience of growing up differ in the early 21st century compared with previous generations, such as those in 1958 or 1970 cohort, were their experiences different, were they similar? To collect information on previously neglected topics, such as father's involvement, season of birth and childcare, and to investigate the wider social ecology of the family, including community and services and geocoded data, for example, linking school and neighbourhood data. So briefly, the design of the study has a number of important features. As I mentioned a moment ago, the cohort was born over a 12-month period in order that the effective season of birth can be taken into account when looking at the results. This is one of the ways in which the MCS is different from the other British cohorts. The cohort covers the whole of the UK and has proportionally greater numbers of families in Scotland, Wales and Northern Ireland. These boosted samples were paid for by the devolved administrations in order to ensure that there were sufficient numbers of families to make comparisons of families within the same country, as well as to make comparisons between countries. The sample for the study was geographically clustered by electoral ward and in order to facilitate analysis using geographical indicators, such as whether families live in urban or rural areas, for example. and in order to investigate the effect that the area in which people reside has on their lives. In addition, the cohort has an overrepresentation of children from minority ethnic groups in order that sufficient numbers were included in the study to make comparisons between ethnic groups. Also, children from deprived areas were oversampled, so the effect of disadvantage could be better understood. So now moving on to sampling. The sampling strategy was every child born within eligible dates should have known non-zero chance of selection. It was drawn in 2 stages. The first stage was the selection of electoral wards, and the second stage was the selection of families within wards. All of the electoral wards in the UK were allocated into one of 3 types: ethnic, disadvantaged, and advantaged. The ethnic was defined as wards in England in which 30% or more of the population were Black or Asian, according to the 1991 census of the population. The disadvantaged were the poorest 25% of wards which weren't classified as ethnic, as defined by the 1998 Child Poverty Index, which is based on the proportion of children living in families in receipt of state benefit. And the advantaged were all other wards not classified as ethnic or advantaged, but that doesn't mean that they're well-off areas. It just means that they're not the poorest 25%. A total of 398 wards were chosen for the study, with proportionally more chosen in Scotland, Wales, Northern Ireland, and from those classified as ethnic and disadvantaged. So there are 9 groups in total, strata. We have England ethnic, and then for each of the 4 home nations, we have disadvantaged and advantaged. The sample of children were selected from the child benefit records held by the Department of Work and Pensions. At the time, child benefit was near universal non-means tested benefit, which all families with children received. 27,201 families were selected. The Department for Work and Pensions sent out opt-out letters to all families claiming child benefit at an address in one of the selected wards for an eligible child. Non-opted out families were issued to the fieldwork agency. So just looking at briefly at the achieved sample by sweep. Of the 27,201 original sampled families, 8,552 families took part at sweep 1, which is a 72% response rate. At sweep 2, we recruited an additional 692 families in England who were not sampled at sweep 1, even though they did have an eligible child. The reason that they weren't sampled at sweep 1 was because they weren't on the child benefit register at the time of sampling, as they were still working their way through the benefit system. From MCS 2, our cohort totals 19,244 families. That is an initial 18,552 and the additional 692 families recruited at MCS 2. All of these families, except those who have died, emigrated, and a small number of permanent withdrawals, were approached for MCS 6. As you can see, we achieved 11,726 interviews with families at MCS 6 when they were age 14. And Tarek will talk more about the response for the age 14 survey in the last session. So far, I've been talking about the number of families. However, if the cohort member was a twin or triplet, their twin and triplet were also included in the survey. So although we have 19,244 families, we have a total of 19,519 families. At MCS 1, we had 246 sets of twins and 10 sets of triplets, and at MCS 6 we have 11,726 families and 11,872 children, where we've got 150 twins and 8 triplets. So just to give you a brief overview of MCS 1 to MCS 6, and as you are now well aware, we have conducted 6 sweeps of the MCS. The first we conducted in 2001 and 2 when they were 9 months, then every 2 years until they were age 7, then age 11, to the most recent in 2015 when they were age 14. At each sweep, there has been a main and partner interview where information is collected from the mother and her partner about themselves and the child. At age 3 and 5, the child started completing cognitive and physical assessments, which Kate will talk about in session 2, while at MCS 4, the children filled in a self-completion survey about themselves, and the content is expanding as they're getting older and can voice their views. At MCS 2 and MCS 3, questions were asked of older siblings who were aged 10 to 15 about school, life at home, hobbies, and more. At MCS 4 in the UK and MCS 5 in England and Wales, there were teacher surveys. And also we have consent from the cohort families who they've been asked if we can get educational to age 16, medical to age 14, and also economic records. The MCS data, MCS 6 data, which I'm sure you're all interested, will be deposited at the UK Data Archive by the end of March. And MCS 7 is piloting at the moment and will be in the field in 2018. So just to give you an idea of where to go for data and documentation, there's a wealth of information about the MCS from various web sources. You can get data and documentation at the moment for MCS 1 to 5 and soon MCS 6 at the UK dataservice.ac.uk. Also, documentation is available from the CLS website. We have things like technical reports on sampling, response, things covering about mobile families, and guides on analysing the data. And also at CLS, specific documentation for each sweep, along with initial findings for those sweeps. Also, if you want to have a look at publications, search for publications that have been done using well, any of the cohorts at CLS, but MCS, including MCS, there's a bibliography of all known publications based on CLS cohort data. And if you go to www.cls.ioe.ac.uk/bibliography, then you can search for publications by year, study, author, journal, title. And just to say also, if you have any publications when you're using the cohort studies or doing the future, it would be really helpful if you could email the details to CLS so we can also include those papers as well. So now moving on to accessing the MCS data, I'm going to quickly show you how to do that. So you need to go to the ukdataservice.ac.uk, and if you go to that website, you'll see this screen. And you can download all CLS data, including the MCS, for free if you're a researcher in academia, a government analyst, or work in the third sector. You can also browse without actually downloading and see what's there. So if you click on get data, which is in the screen at the top there, you'll see this screen. And if you look at the bottom right, you can see quick access to, and one of the categories there is longitudinal studies. So if you click on longitudinal studies, you'll get a list held of all longitudinal studies held by the UK Data Service, which includes all the CLS data sets and MCS. So if you click on MCS, you'll get this screen, and you can see that there are three types of data access that appear. You've got the GN 33359 Millennium Cohort Study 2001, and then two other files. One is a special license access and one is secure access, and you'll need additional permission for the last two data types because the information is deemed as highly confidential. So if you click on the first data file, which is GN33359, you'll get this screen here. And as you can see, this is data from the first 5 sweeps. And for each, there's a main survey. For example, the top file is the 5th survey, and then additional files for data captured at particular sweeps. For example, for MCS 4, as well as the main survey, there is also a teacher survey and a physical activity data file. And if you want more information on what's covered in each of these files, you can click in there, and there's information on contents. There's a technical information. There's a list of variables. So there's quite a lot beneath that you can browse and have a look depending on what you're interested in. So if you click on one of those, and if we take the first one, which was the main file, there'll be a number of files for each sweep, and they'll be based on who responded and about whom. This shows the files in the MCS 5 survey, and I won't go into detail here, as Vilma will be talking about the sweep 5 data in session 3, which I'm sure is of more interest. So if you want to actually download the data, you need to create an account on the UK Data Archive, state the purpose of the project, find the data sets of interest, and then click on them in the download button that I just showed you earlier, agree to data security and other policies, and then download the data and related supporting documents. And you can download the data in either SPSS or Stata. If you go to the top screen at the UK Data Service and you click on register, you'll get this screen. And so if you look below at the new users and you see registration, so if you click on that's where you need to start in terms of getting going on that. So I just want to thank our funders, our main funders, the Economic and Social Research Council, and the host institution, UCL Institute of Education. And that is the end of the introduction. Thank you very much. And if anyone's got any questions about this session, we'll go through them now. Okay, I've got a message from Marguerite. She says, hi, will copies of presentations with links be circulated to participants? There's a very quick answer to that. That's a yes. So after probably tomorrow, by the end of the week, we'll circulate updated copies to everybody who's logged onto the sessions. Andy Atkins asking, will all data from MCS 6 be available at the end of March, including the physical activity data?
All the data of MCS 6 will become available by the end of March, but the physical activity data will be available around June 2017, so 3 months later.
That was Vilma, by the way. Has anyone else got any more questions? Oh, Roberta asks, will geographical data be available outside the UK? No.
Indexes of multiple deprivation will be deposited, but if you mean sensitive data, that needs to be discussed with the UK Data Service, where you access the data from, and they make arrangements for you to access them. So I assume that you mean access them from your home institution that is not inside the UK. This is what I answered on.
Nassif asked, do you need to be an ESRC researcher to get access to secure data?
I don't think so, that you need to be actually specifically ESRC researcher, but for sure you need to contact the UK Data Service, where you fill in a form with the objectives of your project and why you need the data, and they make the arrangements on how you can access them and for how long you can use them.
I don't think you need to be an ESRC specific researcher, but they go into quite a lot of detail about the project that you're working on, and it can also you need to have secure access to a secure PC, and then you actually need to go on a training session as well. So it can take quite a long time to actually get the secure data. Will the secure access data be available in March? For example, geographic identifiers, health and education.
Most of the data will become available. For example, geographic identifiers and health will become available, and some education variables will also become available then. Not all the secure data are ready now. We are working on them and will be ready later in 2017.